Complete Health's mission really is to provide outstanding care to our patients, provide outstanding backup to the physicians and the nurse practitioners and physician assistants that work with us, make sure that everyone has got all the resources they need, and just really deliver an outstanding patient experience.
The providers are who drive excellence. Nothing happens without the right provider.
It really is the driving mission of why I wanted to be a doctor. I wanted to be able to help people.
This is a physician-led and a physician-directed company. We make really all the decisions.
We're looking for like-minded physicians that are focused on quality, that are focused on prevention, that are focused on improving the way that they can take care of their patients through things like patient-centered medical home, which we're very proud to be accredited for in all of our locations.
So what I'm looking for is somebody interested in that culture, and once we're there, the rest is really easy.
By having programs like chronic care management with RNs and LPNs and medical assistants, that's an extension of what the physician can do in the office. By having staff like member support representatives, that's an extension of what goes on in the exam room. So physicians are very, very happy to have all of these support people to help take care of patients.
We want the physicians to be physicians, to practice, to take care of that patient's healthcare needs, where the MSR will take the other concerns, trying to keep them out of the hospitals when not necessary.
They provide, again, a wonderful team to work with.
We bring incredible technology. We bring support to physicians. We're going to bring everything forward so that when you see a patient in the clinic, you are taking care of everything that's gone on with that patient in that moment.
With those resources comes the ability to spend more time with the patient, to be more intimately involved with the patient.
It's something that's absolutely dedicated in primary care, and if that's your desire and that's what your career to be, I think you definitely need to look at Complete Health as a career choice.
When you go into primary care, you have chosen a long-term relationship with your patients. Keeping those patients first is the relationship that you're building.
I think that when you go and you decide what you're going to do with your practice, you want someone who's going to go and be a partner with you, and not someone who's going to have dictates and rules and regulations that make the practice of medicine a terribly unpleasant thing to experience.
We want happy providers, we want happy patients, because there's no better outcomes than when you put those two together. So we want doctors that are willing to be innovative, we want doctors that are willing to look at the current model and say, we can do better. And we want to have just a team-based approach to care, and that's really going to be the culture of our Complete Health practices. And by doing that, we'll be able to take better care of our patients and better care of our providers.
We need to find somebody who is culturally minded. That doesn't mean they have to have all the elements in place. That's what we do. That's how we are special. That's what we're going to bring to the table.
I don't know how long I want to work. I don't know if I want to retire in 5 or 6 years or whether I want to go on to 75. I foresee myself working a long time. I think I can do that with Complete Health.
I recommend it for any physician at any time in his career.
I can personally say that it has been a very pleasant experience being able to be allowed to do what I was trained to do, and that's to take care of people.